Hello, I'm Dr. Kiran, and today we are talking about measles, what it is, what the symptoms are, how it spreads, and how you can keep your friends, family, and your children safe. Measles is a highly contagious and serious viral disease that can lead to complications such as meningitis, pneumonia, and inflammation of the brain known as encephalitis. Measles also causes your immune system to work less well, so once you contract measles, you are far more likely to get other infectious diseases. This effect can last up to 3 years after you've had your initial measles infection. Measles usually starts with cold-like symptoms, red eyes, sensitivity to light, a fever, and greyish-white spots that appear on the inside of your mouth and at the back of your throat. This is followed by a red-brown rash, which usually appears from behind the ears and spreads to the rest of the body. The rash can look really different on white, brown, and black skin, so it's really important you familiarize yourself with how it looks on different skin tones. A child with measles can be unwell for up to a week, although may take several weeks to recover and be off school. In developed countries such as the UK, 1 in 5 children will visit the hospitals with measles, and 1 in 15 will develop a complication related to measles, such as ear infection, diarrhea, lung infection known as pneumonia, and encephalitis, which is inflammation of the brain that can lead to brain damage. In rare cases, measles can lead to a complication known as SSPE, subacute sclerosing panencephalitis. SSPE can develop many years after the original measles infection. It causes dementia, loss of motor control, epilepsy, and eventually leads to death. Even in developed countries like the UK, measles is associated with 1 in 5,000 deaths. This number is higher in developing countries. Measles is spread via coughing and sneezing. It is one of the most contagious and infectious diseases. In a group of 100 children that are unvaccinated and unprotected, once measles gets into this community, 90 of them will become infected and 7 of them will go on to develop a serious complication. Children and adults are infectious from when symptoms first appear until 4 days after the rash develops. It's important, if you think you or your child has measles, that you stay at home and contact your doctor. This stops measles spreading to vulnerable people such as very young babies, those with weakened immune systems, and cancer patients. Currently, there is no treatment for measles. You can protect yourself and your children by getting the MMR vaccines, which protects them against measles, but also mumps and rubella. The MMR vaccine is given in 2 doses, aged 1 year and again at 3 years and 4 months. Both doses are required for long-lasting protection against these preventable diseases. In the UK, we have 2 types of MMR vaccine, MMR Vax Pro and Priorix. Priorix does not contain any gelatine product, so any parents wishing for their child to have this as an alternative can speak to their doctor. The MMR vaccine is very safe and effective. It contains a live attenuated vaccine, which means that the viruses of all the diseases have been weakened so that they can elicit an immune response without causing disease. Most of the side effects of the vaccine are mild and do not last long. Common side effects include redness, pain or swelling around the injection site. About a week after the vaccination, some children can develop a measles-like rash as the measles part of the vaccine begins to work. About 3 weeks after, some children may develop swollen glands underneath the jaw, and this is when the mumps part of the vaccine begins to work. As with any vaccine, medicine or food, there is a very small chance that you may have a severe allergic reaction known as anaphylaxis. The overall rate of anaphylaxis with the MMR vaccine is 1 in 900,000. Lots of parents often ask me whether there is a link between the MMR vaccine and autism. There are now lots of large studies with over 1 million children that prove there is no link between the MMR vaccine and autism. It's important to remember that the possible complications of infectious conditions such as measles, mumps, or rubella are far more serious than not being vaccinated. If you are unsure whether your child has had the MMR vaccine, please check their red book or their vaccination record. If you still have any concerns, please pop them in the comments below or consult your own doctor. Thank you for watching this video and I hope you found it useful. Remember to like, subscribe to my channel and share this with family and friends.